This is Jason from that podcast in Hutch, and you're listening to An Ounce of Prevention with Candace and Kara.
Hi, this is Candace.
And this is Kara. And we're excited to talk to you today about the history of public health.
I am so excited that we're doing this. We've been talking about it for a minute, and now we're here and we're doing it, so I'm really excited. And today we're going to talk about the history of public health, and I think I'm probably going to learn a lot of things I didn't know. So
Maybe.
Well, let's find out. You could test my knowledge and see what I know about public health. It's probably not much. Where did public health start?
So we can go clear back in the annals of time to the very beginnings of Socrates and all of that to public health if we'd like to. We're not going to go that far back because that seems ridiculous. But we can start in 1946 and the Center for Disease Control because that's still around. People know about that, right? So that is actually when they started. And their big mission was to prevent the spread of malaria throughout the nation, right? So we're still dealing with malaria, especially in some other countries, but that was their start. That's what they and making sure that community health was important, and that was where they came in. We kind of moved on from there. Rabies was part of that. Seatbelts was part of that, just as we continue on with the history of public health. But probably locally, Kansas, our big public health thing was Samuel Crumbine. So he was around in the early 1900s, and he actually started Swat the Fly, which was a health initiative to really get rid of flies and again, malaria, all of the things that they carry. So he started a Swat the Fly campaign to help farmers to get rid of flies and get rid of
the diseases they carried, right?
Correct. Yeah. Yes. Yeah. And then he also wanted to ban the public drinking cup because up until then, there was just a cup sitting on the side of the well, and you could have a drink out of it, and everybody drank out of it. So weirdly, there's a lot of communicable diseases back then between, the communal drinking cup and then also the communal paper towel. That was the towel on the roll. I don't know if anybody ever remembers
those. We still see those in gas stations.
Yeah,
the wrong kind of gas stations.
Right.
You just pull it through, right?
Yeah, yeah. So tried to get rid of those as well. He also had a Don't Spit on Me. That was when TB, tuberculosis, was really big in Kansas. And so he started that initiative so people would stop spitting on the bricks and spreading TB.
So this is an interesting thing. I do know this part of the story. People laugh about laws that said don't spit on the sidewalk. And they're like, these old laws that say don't spit on the sidewalk. But those actually have their origin in the spread of tuberculosis, right? We used to have public spittoons everywhere.
Yeah,
right?
that's public health. So those don't spit on me or don't spit on the sidewalk, as funny as that is a public health initiative. Some of those bricks are still around today.
Yeah. So this gives me an interesting perspective, I think. People, they just kind of live their lives, right? And I think if you go back to a time where everyone's spitting tobacco juice on the sidewalk or they're drinking from a public cup, that is a normalized behavior at the time, right? So without some education intervention from public health, people don't necessarily know that to stop doing this, right?
Right. They didn't know where they were getting TB from. They didn't know that they were spreading. They weren't trying to spread disease, right? That wasn't the point. It was just normal. So having someone tell you that, hey, this is actually how things are spreading, before in early 1900s, doctors didn't wash their hands in between, doing an autopsy and helping a woman give birth. And so babies died because of complications, and they didn't realize there was a correlation between the two. So having somebody stand up and say, hey, there's something going on here, and kind of showing that to the public and explaining that is always good.
So what kind of person do you think is – it seems like the kind of person that would do that level of research would have to be insanely curious and care about what's happening with people to want to dedicate time and just say, well, I wonder why this is happening and what can I do to help all these people stop dying.
That's where it really starts, is that curiosity. Okay, we're seeing all these maternal child issues coming along. What is the correlation between each one of them? Tracking that down, which is like modern day epidemiology, right? Like tracking down that disease and figuring out where something went wrong is really what leads to those public health conclusions. And then it takes someone like Samuel Crumbine to go out and say, hey, wash your hands because we're finding correlations with this. And that's where health education comes in.
And now we go from there where people aren't doing these things to now that is not only a standard practice, we now have like very regimented ideas about how hand washing happens pre-surgery, pre-op, post-op, all these things. And hardly anyone spits on the sidewalk anymore, right?
Right.
But we kind of know like this is a thing we don't do.
Yeah. And you get called out for it now, right?
Yeah.
Like, that's gross. Don't do that.
Yeah.
Whereas before, it was just a normal behavior. So those catchy slogans, as much as we're like, they make a difference. The one that my friends always yell at me about is, don't just pack it, wear your jacket. Because if you're going swimming, especially in the lake, you should always wear your jacket, right? That's old Red Cross, like, burned into my brain from when I was a child. So those catchy slogans help you remember those important things.
Buckle up, buttercup, click it or ticket. All of those are public health slogans. You remember them, right?
Yeah.
And so that's really where that don't spit on the sidewalk came in, is that catchy health slogan that you're going to remember. Oh, I shouldn't do that.
I started wearing my seatbelt when my kids were very small and said, buckle up for safety, Dad.
Exactly. Kids can do all sorts of things.
Oh, yes, they can. So we got Crumbine in the early 1900s doing a lot of work. I'm really curious about malaria. You talked at the first part of the episode about the CDC was really involved in work around malaria. That is spread by mosquitoes, right?
Correct.
And it's a serious, it kills. At one time, I don't know if this is still true, malaria was responsible for more deaths than just about anything.
Yeah.
Right? Worldwide.
Yes.
Yeah. So that was a big portion. They had malaria control, and the CDC had trucks that would go around and spread information about that. And then it was eliminated and considered eradicated by 1970. So eliminated by 1950, eradicated by 1970. However, we know that malaria still exists in other countries around the world. But in the U.S., it's eradicated, and that's due in large part to the education and public health initiatives.
What sort of things were put in place to be so successful in the United States?
Things like making sure you know where the mosquitoes come from, right? So making sure you get rid of standing water. That's why we do the dunks. Unfortunately, we don't have the dunks at the health department anymore, but you can buy them at any large retail store. And
also available at K-State Research and Extension.
Plug for K-State Research and Extension.
Also, making sure that there's not the breeding ground for the mosquitoes, and then just the education on how to make sure that you're taking care of yourself if you have any of the symptoms, going to the doctor so that you're not part of the spread as well, and then having all of those things available for people in the United States as well, or anywhere else, right? But that's how we got rid of it.
This is striking to me. We've been so successful at not having malaria in the United States, I don't even know what the symptoms of malaria are.
Right.
What are they?
That's a great question, Jason. Let me.
We'll get back into the history in this, but one of the struggles with public health is that I've always said this, if it's successful, it feels like you don't need it, right?
Oh, correct.
Because we don't talk about malaria because we don't have malaria. You don't have people dying next door to you from malaria. Right. And that wasn't just chance that happened. That was a long-standing, very multi-decade effort to make that happen. Yep. But to be here where I am now, having lived with mosquitoes my whole life, and begrudgingly, by the way.
Right.
All of us.
Yes.
But I'm living here begrudgingly with mosquitoes and have no idea what the symptoms of malaria are.
Well, you can even look. I gave you the dates. Like it was eliminated in the U.S. in the 1950s, and then completely eradicated in the 1970s. So that was a 20-year span. So tons of effort went into ensuring that you're not going to have to experience those symptoms of malaria here, and that's why public health is so beautiful. We hear a lot that public health. It's the invisible work, right? Like we're the invisible behind the scenes, and you don't know that we're successful because it's completely invisible.
Yeah, it just works.
Or we're successful because you don't know that it happened.
Yeah. That's a remarkable thing. Mosquitoes, though, they do a lot of. We'll get into that later, but
that's West Nile.
It's so many things.
Mosquitoes are bad.
Yeah. So actually, in Kansas, we do have several counties that still trap mosquitoes and then send them off to go get tested just to make sure that we don't have all of those different things that they carry. So
was that part of the original effort was to test mosquitoes too to see what they had?
Yeah.
Okay.
And of course, you're like, it's bad now, but DDT, that was a big part of that public health initiative, getting things sprayed across the board. And of course, as time has gone on, we've come up with better solutions for that. But all of those things are kind of that experiment in how can we create a healthier environment for people so that they're not experiencing these like other countries are.
So we're pretty well, malaria is behind us in the United States in the 1970s. There's always, though, a new emergent danger, I guess, and public health has moved well beyond that. I mean, you had mentioned, I think in the first episode, about this public health gets into environmental issues, water issues, soil issues, air issues. So how did that kind of evolve over time in the world of public health?
So in the 60s, we had the measles vaccine. History was marked by that 1963. That was the first one that came out, followed by high reaction rates and improved weaker vaccine. Then was developed by Dr. Maurice Hilleman. That was introduced in 1968. So that really started on that road to getting measles eventually eradicated in the U.S.
Mostly.
Yeah. We did, obviously having another uptick in 2021,
But prior to that, it was almost unheard of. Right?
Correct.
Yeah.
Yes, correct. It had been declared completely eradicated in the United States.
Hold on. She's had this concerning look.
Sorry. I just was like, measles. Sorry.
I know. It's maddening. It's just maddening.
Well, and you get into people's misconception about measles, right? It's freedom freckles. I've heard that. It's like, it's my choice and it's just a rash. Well, it might be just a rash, right? It might be a rash for 10 people that get it. However, the one child who can't vaccinate will get a serious infection with encephalitis.
Oh, yeah.
So the swelling of the brain. So that's hospitalization and perhaps death. So whereas 10 people might have this reaction to it that's uncomfortable, one might have very serious and potentially fatal risk.
I mean, the other part of that is that part of the reasons why measles was eradicated is because we had the herd immunity. Mm-hmm. So as long as there is a certain amount of people that have had the vaccine, then those that cannot for reasons, health reasons, because they're too young, because they're too old, are then covered because of herd immunity with the vaccine. So it's important that people follow those vaccine schedules and really because again, we're talking about community health, right? Making sure that as a community that we're healthy and that we can continue to be a vibrant community. And that's how that happens.
I think that's an important distinction. That there's a difference between individual health and community health. Mm-hmm. There are some things that we do community-wide that go beyond us, mm-hmm. right? That they go beyond I might be able to weather one thing, but maybe it's something else, whether it's a pollutant or a disease or something that I'm not going to be able to fend off. But that's one of the concerns. I mean, we have seen measles kind of make an uptick in the last several years. And part of that is because there's some people who have said, well, I don't think we need to have this anymore, which I think also can be attributed to what we talked about, like polio, measles, smallpox. There's a number of diseases that largely due to public health initiatives, we just don't see anymore. And
Right.
then that gives people permission to say, well, we don't need it anymore.
Right. And we've lost at that point when we start to lose that herd immunity that Candace was talking about. That's when we see that uptick. Because prior to that, people were doing their part. The people that chose not or could not get the vaccine were safe. But now we have a greater number of people that are choosing not to vaccinate. And that's caused our herd immunity to not be existent anymore, which then leads to outbreaks.
Hi, this is Christopher, the producer. One aspect of this is that people have not seen polio in their lifetime. People don't know what polio did to friends and family, and because public health was successful. And now, because public health did their job so well, people are unaware of it. I just want to jump in and say that.
That's a great way to state that. Public health did their job so well that we have been fortunate enough not to see these diseases in most people's lifetimes, that's the hard thing about seeing some of them come back.
Yeah, is that there's been generation after generation after generation of effort to eradicate these things, and now there's kind of some falling back a little bit.
Right. And everyone's, we live in a country where we get to decide what we want to do. And that's great for a lot of reasons. However, we do need to consider that there are people that can't vaccinate, like newborns and infants. We don't start vaccinations until they're 2 months old. So like these parents that don't have a choice are trying their best to protect their kids.
Yeah.
And I think that's the piece that some people don't see because, yes, it's your individual right, but someone else doesn't have that choice. And that's where we get into some of these debates.
And it's such a, well, I would guess I would add to that too. We also live in a world where anybody with a keyboard can present themselves as an expert on anything. And I think it's always important to make a distinction between your several months worth of research on YouTube is not the equivalent of a person with a PhD who studies virology.
Yeah. Right. And then we go down the rabbit hole of, yes, we live in an age where we are fortunate enough to have information at our fingertips, and that's fantastic. However, it's determining the correct and reliable sources that gets us into a little bit of trouble. We know our algorithms are swaying us whatever way we tend to lean towards. So we're not always getting an unbiased or neutral opinion or factual opinion necessarily one way or the other if we're solely relying on those sources that are always our go-to. And so it's really important. I think it's very valuable to do your own research, but it's also very valuable to know where to do your research and what sources are good points for your research.
So what would be some good sources?
So typically if a source ends in .gov or .edu, in most cases that is a valid source and a good one to look at. If somebody is ending in .com, go double check. Any source you should probably double check. But typically if a website ends in those other two, you're on solid footing. .org or .com are always going to be a little bit more biased one way or the other just because they are able to typically because they're usually a for-profit entity.
Maybe sometime we'll talk about peer review.
Yes, that's right. So if you want to, go down that way deep and really get into your research, yes, making sure that it's, vetted and, has all of the correct things behind it, then
I think another valuable thing, if you get into some research and you find a study, because there's studies just about everything under the sun, is to look at the sample size of the study. If they've only studied, 100 people, that's not a valid sample size for whole populations. So that's another thing to look at is what is the sample size? Who was conducting the research? If it was Kara Bunce conducting the research, that's not valid.
I think that's a really good point to be careful about where the research comes from. And also even just on research, knowing that a study is a study it might be the first of many studies, and it's not the definitive answer. Also, science is a constant evolution. We are, as we learn, we adjust. We used to think that putting leeches on people was a way to solve a problem. And then we learned not. And then we used to think that spitting on the sidewalk was fine, but it's not. It's like we just evolve as we learn more, which is what ideally you hope happens.
And I think in this, like, one thing to keep top of mind is to be curious. So if someone's saying that this is good or bad one way or the other, just to ask some more questions from a curiosity standpoint. Tell me what makes you think this, and just really lean into that curiosity, because it's, like you said earlier, it's really easy to be a keyboard warrior and put opinions out there. But when you see something that you may disagree with, ask some more questions or find someone else to, get that information from. We're open doors at the health department. So if you have a question about West Nile in our area, or if you have a question about a certain vaccine and the ingredients, it's not a secret society. We have open doors so that people can ask us those questions. And we would love to tell you about, vaccine ingredients if you really get down to the nitty gritty and what each ingredient in that vaccine is for. So I think that's important too, is to know that, like, if someone's oftentimes telling you the truth, we're going to be able to tell you every single ingredient in that thing and what each one of those ingredients does in a vaccine. So find those people that are going to give you, like, the down and dirty, the nitty gritty of all of the stuff that you're curious about. And I know for us at the health department, we're going to give you that information. But also, if we don't know that information, we're going to find someone who is a trusted expert to do that. And we're going to be open and honest.
And you have access to a lot of resources.
Exactly.
Because you're part of a bigger, broader network of public health officials, right? Tied to this KDHE, and then there's associations with other states and so on, right?
Yeah, we're an accredited health department, which is there's 6 accredited health departments in the state of Kansas. From the Public Health Accreditation Board. So that's a stamp saying that we have met pretty stringent requirements in order to get that certification. And on our staff, we have an epidemiologist. So she's our disease tracker, has data, as well as, like, nursing staff with years and years of experience. So I speak highly of Reno County Health Department because I don't believe people know what a gem it is in the state of Kansas.
And how highly qualified the people that are working there are, right?
That is correct. Yeah.
So you've got us about to the 1960s with measles. What comes in the 1970s and 80s?
So 1970s, we had Legionnaire's disease. That was a fun one. It actually got its name from the amount of people that got ill and died from a convention of the American Legion in Philadelphia. So it was water droplets in the air conditioning system that caused the bacterial lung disease. That's where Legionnaire's gets its name from, and really thinking through how that public health and safety, building safety, work safety, all of those things kind of going hand in hand.
And that really gets into the environmental aspects of public health. It's not just, you think of these, like, communicable diseases that we're spreading person to person, but then there's also these diseases that come from our environment.
Correct. Yeah, that's where we say public health is part of everything.
Because it touches all of this, and then when there is something that happens, public health usually ends up getting involved in some facet or another, right? Yeah.
The most recent, kind of thing that comes top of mind is Flint, Michigan, and the lead contamination in the water, right? Like, and that was 2016, and so that's was public health, coming in and making sure that lead contamination got out, and that Flint eventually had some drinking water that they could drink.
They finally just now started addressing some of that with new pipes, if I have read correctly.
Right. Yeah.
But part of this but that's a thing where it starts with a problem, and then it's testing the problem. And if I remember that case right, if you hear that in the background, it is really storming right now. So we're
this is how important public health is.
That's right. We're not in a public health emergency, but we are in a severe weather emergency right now.
Actually, now that we've had that, public health is emergency preparedness too. That's a public health initiative as well.
Yes. You guys kind of run part of the simulations, right? We do
Correct.
mass casualty simulations and storm relief simulations, and that training happens a couple of times a year, if I remember correctly, where we pull all the agencies together and say, what would we need to do if there was a mass casualty event? Yeah.
Yeah.
So
EMS
that's public
fire.
health.
Yeah.
Yeah, making sure we know how to treat a bunch of people if power is out, if there's a high number of people who need assistance, if there's a huge explosion.
And you think about like even tornadoes, that's a natural disaster, but then we're still concerned with potable drinking water and all of those things. Again, public health is right there trying to make sure that even amidst this, we are taking care of our community members.
Yep.
Yeah. And with tornadoes, the other thing that you don't think about a lot is tetanus and how much that becomes a thing in tornadoes. And so that I know in several of the tornado disasters that have happened recently, that's what we've gone out and done as the Reno County Public Health Department has gone out and done tetanus shots because most people are not up to date on their tetanus shots.
That's true. But they're out, but they just go into action and they start cleaning up their properties, or volunteers come out to help clean up properties. That's fascinating. Those are things I think, and I want to get to that at some point before we end this episode, and maybe carry on to the next episode about some of the things you guys do that people just don't know.
Yeah.
I could probably ask 10 people on the street whether they knew that you guys did that, and I would bet most of them would say they had no idea. Yeah. So on the history here, what do we have after Legionnaire's disease that kind of moves us forward in some of the public health discussion?
Well, we go to the
AIDS epidemic is definitely the next, big 1980s, the AIDS epidemic and how that all transpired, and making sure that people were aware of how you got AIDS, and that it, wasn't just drug addicts or just the gay men or, any of those kinds of things, that it was out, that we needed to make sure that we were taking care of ourselves and our neighbors, and really how that all went down.
And also at the time, dealing with a lot of early misinformation about how it was spread.
Yes.
And because I remember I was a child at the time, but I remember there was a conversation about drinking fountains and could it be spread that way? And there was a lot of panic and paranoia about how this was spread. And so part of the effort was to kind of bring that conversation to reality a little bit.
Yeah. In 1987, CDC launched its first AIDS education campaign, and it was called America Responds to AIDS, and kind of dispelling some of those common myths and providing some more information. Public health, a lot of public health departments around the U.S. also have the Ryan White Foundation. And I don't know if you remember this, but I remember the made-for-TV movie about Ryan White. And he was essentially a child and received blood transfusion and contracted HIV.
Yes.
And so that was really like the turning point of this isn't just this population. And so it was a lot of education and dispelling those myths to say, here's what it is, here's what to be aware of, and here's how you can protect yourself from that.
And that also, brings about health and safety of blood transfusions, and how do we make sure that our blood supply is, and so all those questions that you have to answer if you ever give blood, and just those conversations that we can now have openly with people about, how the blood is treated and what happens when it comes through, and
a lot of this
all those
is the
important
product
safety
of
things.
Learning and adapting.
Correct.
Right? We have a problem, we learn about it, we study it, and then we adapt and try to move forward with that.
Yeah.
I remember that, and of course that's been remarkable in my life to watch from where we were in the 80s when I was young to now, where there's a host of treatments that are pretty effective.
Yeah.
It's moved wildly, the research on that.
It's something I never thought I would see in my lifetime, and it's just incredible to see that.
Yeah. So we've got AIDS. Any big things in the 90s that we
Well, before we go to the 90s, I got to talk about the 3 Mile Island nuclear accident.
Oh, yes.
Because that accident was the creation really for the National Center for Environmental Health. It was that department was created based off of that, and that's where we get our actual environmental health within the CDC. So that prevents premature death, illness, and disabilities caused by toxic substances in the environment. And so I think that's really important to highlight that that's kind of the birthplace of that is sometimes our public health comes from a disaster and learning that comes out of that.
That we have to do that. And that's testing. I mean, you guys just even here locally, I know you do some water testing, right? You do.
So we no longer house that in the public health department. So environmental health is out of the public works department.
Okay.
And they do go out and test wells and those kinds of things as well.
Okay.
So yeah. Sorry.
Okay. So what happened in the 90s then?
I love talking about this. This is the Vaccines for Children program. It's established in 1994. And the goal of the Vaccines for Children program, or you might hear us say VCF, is to ensure that children, especially those who do not have insurance, can access any of the recommended vaccines regardless of their parent or guardian's ability to pay. So if they are underinsured or uninsured, it's making sure that those children can get the vaccines that they need regardless of the income of their parent. And so that was a great thing.
Correct me if I'm wrong, but I also believe that helps for anyone that's in foster care or anything like that as well. So those kiddos that are in foster care can also receive free vaccinations.
So this is a program that addressed a lot of kids that would slip through the cracks otherwise.
Right, because vaccines can be very costly if you don't have insurance. And so that really was a safety net to ensure that every child can get the vaccines.
Do you know what kind of spurred that on?
The Vaccines for Children program was founded in response to a major U.S. measles resurgence between 1989 and 1991. So over half of the infected children during that time had not been vaccinated due to the high cost of the vaccines, despite having many regular healthcare providers. So they had access to healthcare providers. They just didn't have the insurance to get the vaccines.
So in order to address the medical cost of the vaccine, then we created a program to make sure that, and again, that's an investment in community health to make sure that everybody has access to what they need.
That's correct.
Fascinating.
Yeah.
Yeah, I like that. Okay, so where did we go next then in this history timeline?
So in 2000, measles was declared eliminated from the United States. Obviously, this status has now been at risk due to the high case number and sustained outbreaks. So as of April 2026, we were over 1,600 cases reported in the U.S. So we have not officially lost our elimination status, but we're pretty close.
Pretty close. It's a little dicey right now, right?
Unfortunately. Yeah. Then we move on to some fun things like anthrax.
Anthrax.
Yes. So in 2001, we had the first case of inhalation anthrax, and so since 1973. And so they responded pretty quickly to that. There was a lot of if you were around in 2001, I feel like you heard about anthrax almost daily, and you were afraid to open your mail, right?
I worked in a post office. There were precautionary measures that were actually put in place during that time, thanks to public health response.
Yeah.
Oh, yeah, because after 9/11, there were anthrax letters sent out with anthrax powder in them.
Yeah, and threats for more. So
yes, and so people were like if you got mail from somebody you didn't know.
You didn't open it
in a closed space or anything. Yeah. Oh, wow. I forgot all about that.
Yeah. And that's great, right?
Yes. Another good thing to have forgotten about.
Yes. Yeah. And then we had SARS in 2003. That was that severe acute respiratory syndrome. Again, like if you're around, you kind of remember back to like, oh, yeah, that was a thing back then. But we've did some stuff to make sure that it wasn't around. And that's what public health is here for, is to make sure that we're doing those things.
Well, and I'm going to talk about this because following that, we had the H1N1 outbreak, aka the swine flu. And that kind of hits near and dear to my heart because 2009, my son was born prematurely. And so he was born right at the start of the H1N1 season. And so it was very important that those around him got vaccinated because, of course, he couldn't. But we needed to make sure that we protected him. Because he was on oxygen for 2 months. And so that's really where that herd immunity is so important.
And H1N1 was serious. I mean, it was knocking people down in a hurry. It was a violent
It was the
flu.
2009 version of COVID.
Yeah. Yeah. It was bad. So it seems like we had like a series of, because I remember like it just was one thing after another for about a 10-year period there.
Yeah, we had SARS, you had H1N1, and it was like SARS, whatever iteration of that. So, yeah, we did. And again, we responded. Jason, you mentioned that, it seemed like we had a new virus or a novel virus, every couple of years around that time. And, it was during that time, the SARS, I think you might even recognize it when you got the vaccine or when we talked about COVID, it was SARS-CoV-2 or whatever. So really, it was research from 2009 and before had already been done leading up to a vaccination. And so when we got the COVID vaccine, it wasn't like it was just overnight.
Yeah.
That's kind of the birthplace of that. That research had already been done and had been in testing phases since those outbreaks in the early 2000s. And so we had the groundwork for that vaccine.
Yeah, we had almost 20 years of previous public health
And I don't know if a lot
work
of people realize that.
Well, because at the time it seemed like it just came out of nowhere. But that's the difference between my many hours of YouTube research and somebody who's actually done like a PhD level research, right?
Yeah.
Like there's a whole bunch of work happening in the background, thousands of people all over the world working on a solution to a problem that I don't know anything about.
Well, and you think to the early 2000s, I don't know where you were at, but we were not inundated with that information. So we had a vaccine, it was there, okay. And I think now we're so inundated with information that we haven't been updated daily that this is the progress of the, SARS-CoV-2 vaccination.
Yeah, we just don't see that over. Yeah, and now something happens, and everybody, like I said, everybody with a keyboard can come out as much of an expert as anybody with a doctorate degree, and crazy. So we kind of go through this period, and then I can't remember what it is. I want to talk about one local issue that I remember, that predates you guys. But I'm sure at the health department is the topic. It's a subject of lore. The hepatitis outbreak at Sonic. What year was that?
2001.
Yeah.
So that Hep A outbreak that happened at Sonic, Reno County is the one, the health department is the one that responded to that. So they identified 9 cases. In June and July, restaurant workers they were identified as the source of spreading that, of the hepatitis A. And then by October, we had a declining number of hepatitis A cases because, so during that time between February and October, the Reno County Health Department administered 3,154 immune serum globulin injections. So they administered 2,370 hepatitis A vaccines, and they conducted 1,000+ food service inspections, visited 100+ homes, provided follow-up investigations for 500+ contacts of those hepatitis A cases. So they were constantly out talking, and then also did a big push on washing your hands.
Yeah.
Because that's how you
Basically
stop.
how it was spread, right?
Yeah.
I always remember that. I also remember this in the context of COVID because I remember, admittedly, what an anti-public health pushback there was during COVID. But I also remember how desperate people were to access public health during that period.
Yeah.
And I mean, there were lines of people to get vaccinated. Anybody who thought they had eaten at Sonic in that window of time was begging for a vaccine. And it always just was remarkable to me how that turned so quickly in a short period of time, which maybe takes us to probably the most significant recent mile marker in public health, which would be COVID-19, and which admittedly was not. I haven't worked in public health, but I imagine I saw it, and it must not have been a good time to have been working in that field.
Yeah, so I can speak to this. I have some personal experience. So like I said, I started public health in 2018. And when I was hired on as a health educator in 2018, my job was to go out and talk in schools and hospitals about tobacco use. And helping to, get kids off of tobacco and talk about how big tobacco affects and all of those things.
Yeah.
So then my calendar was full. I was out doing all the good work. We were having all these great conversations about tobacco and all of the other things that public health related. And then March of 2020 rolls around, and all of a sudden my calendar is completely clear because, like I said, I was talking at hospitals and schools. So they were no longer in session. At first, everyone was glad that the health department was there to help out, right? So we had lots of conversations about how we could help in this emergency situation, people came to us for masks for free. We also gave out gloves and hand sanitizer, all of that stuff. We had people lined up, not lined up because we didn't want to be that close to each other, right? But we did have people at scheduled times coming in to get their supplies for COVID. Then, 6 months down the road, all of a sudden, people didn't like us so much anymore.
Yeah.
And there was definitely a big pushback. I can tell you that that's part of why we have new leadership at the health department is because Nick Baldetti was the face of the COVID
the response.
Yeah. And people got really angry with him and started to
there were some threats.
Thank you. Yeah, there were definite threats against him and his family. Yeah, right. And so he moved on. He went on to a different job because what do you do in that situation, right? Like your family is way more important than a job. And there were threats against the health department. There were threats against, at that point I was doing contact tracing. So I would call families and let them know that their kiddo had been, the school had let me know that their kiddo had been in contact with someone with COVID. And so they had to stay at home.
Okay, so I was on the receiving end of one of Candace's calls. I was in the classroom at that time. And so I think that may have been where some of the pushback started was now it's starting to interrupt some of our daily lives. We were finally getting back into the classroom. We were finally going places. And then they're telling us that we have to, quarantine or do whatever.
Yeah, I definitely had some very upset parents when I would call. And so I actually left public health for a while. And actually, if you look at the public health employee makeup anymore, workforce, there is not a lot of long-termers left.
Yeah.
A lot of them left during COVID. It was a learning, we talked about this earlier, right? It's a learning curve. We are learning, we're doing the best we can with the information that we have, and so it changed. And it changed multiple times, and it probably was not put out in the best way, right? We can own that mistake. It definitely was not put out in the best way all the time. Also, we need to be aware that it's a learning curve, right? It's science. It's always changing. And so we do better when we know better. When we have more information, we give better information. And so that was an interesting time to be in public health and to really interact with the public in that space.
I can only imagine. I remember a lot of the conversations around that. Weird conversations about, we don't need to quarantine. It's just babies and old people that will die. So we're literally,
or it's just a cold,
or it's just a cold or something. And it again, I guess this is worth talking about too. Whatever the information out there that people want to believe about COVID, the underlying issue, as I always saw it, was it was about trying to prevent the overwhelming of existing health infrastructure, right?
100%.
And there are people, I think this gets lost in all this, there are people who died not from COVID, but from the inability to access emergency care because of COVID, because the facilities were overwhelmed.
Yes.
And that is underscoring all of this is what we were trying to avoid.
Yeah.
Right? And as we do in all big epidemics, is to try to make sure we minimize. I remember at the time, it's weird. You actually, from an epidemiology perspective, we talked about flatten the curve. Well, you're flattening it in exchange for having a huge spike in deaths and hospitalizations. So you are, by your definition, trying to prolong, but at a rate that the system can handle.
That's,
right?
doable. Mm-hmm.
Yeah. It just was such an unfortunate thing that it turned so personal and so ugly, and that it pushed so many people, probably really good people, out of the field.
Oh, I mean, prior to that, you would go to any public health function, and the amount of years of service of the workforce was incredible. I mean, 20, 30 years is easily, because people really have a heart for public health. They want to see their communities thrive. They want to see how they can make their neighbors and their friends and the whole community just better in what they're doing in their policy and environmental changes, right? And so there's a big longevity in this work, in the public health work. When you get yelled at every day, every minute almost of every day about what you're doing so that other people can live and survive and thrive, it makes the job not fun. And again, who am I going to take, myself or my job? Eventually,
take care of yourself.
You just have to take care of yourself. And so the amount of people that just left public health in throes was insane. And so now it's a very young public health workforce, which is also good because, having a new and different take on things is good. But it was kind of sad to see all of that happen.
For me, another perspective I had on it is I remember when I was at the news, we had written a story about public health orders in the 40s and 50s around smallpox and polio here in Reno County, where people thought it was draconian in 2020. In the 40s and 50s, they would put a sign on your door that said, "This house is under quarantine," and you would be in violation of the law if you left that house or if you went into the house. Yep. So what we were doing in 2020 was not at all to the level of what we were doing in the 40s and 50s.
Well, and in the 40s and 50s, when those vaccines were new, people would get all dressed up and go see their doctor and be all excited, wanted to be the first one in line to get that vaccine because they had seen the effects, right? That's also part of, I think, what the deal was with COVID, was that nobody really saw, most people did not see the effects of COVID on them because it was, for most healthy people, it was kind of like a flu. But it could be a whole lot worse.
Yeah.
And part of the problem when we have something new is that we might not see an issue now, but I look at some of my friends who are suffering with long COVID. Yep. And so we didn't have the data to show what it could do in the future. And so that's the thing when there's public health guidance, that's something we need to consider too, is we don't know what this looks like down the road. So let's take our precautions now and kind of have a mindset shift of this isn't something that is being done to us, but it's being done for us.
Yeah. It's more, and it's largely built around the idea of erring on the side of caution. And trying to protect the broader community.
It's all about community health, right? That's what we came in talking about, is community health and not personal health. And that's what it is. That's what public health is definitely community health.
So in our community, what are we watching now?
Well, there's syphilis. Syphilis is on the rise. And
you guys, you're everywhere. You're studying everything.
This is true. We get all of the fun things at the health department. So syphilis, especially perinatal syphilis, is on the rise as well.
Is that post birth?
So it's for babies.
Oh, babies being born with syphilis.
Correct.
Okay.
Yes.
Transmitted mother to baby.
Okay. Yeah. Health concerns with that.
So many health concerns with syphilis that people don't necessarily know about. Long-term syphilis can actually cause dementia, and then you have the short-term, the neurological effects. You have the rash and those kinds of things as well. But if it's not taken care of, it can lead to death pretty substantially.
And that's another one of those things that people don't think often about because we have treatment.
Correct.
And I mean, historically, like syphilis killed a lot of people because we didn't have treatment.
Correct.
So that's just another way that people don't think about the health department because you've done your job so well.
Yeah.
Right. And I don't know if they realize we go out and we talk to schools and other places about sexual health and how to the importance of getting tested because, a lot of those sexually transmitted diseases are invisible. So the only way to know if you have one to transmit it is if you get tested. And so we go out and talk a lot about basically how to stay healthy or how to get healthy. And I don't know if a lot of people know that education aspect that we provide.
You do a lot of education in a lot of areas too. Yes. That's another kind of an evolution of public health that I think there's a little bit of a misconception that people go to the health department to get a vaccine and that's about it. But there's a lot more that happens. But not an insignificant part of that is the education part. You guys put out a notice, or Reno County put out a notice a few days ago about opioid death overdose increases, right?
So it was actually methamphetamine.
Methamphetamine, okay.
This last one. We do spike alerts whenever we have 3 overdoses in a 24-hour period of the same substance.
Okay.
Tracking overdoses was another part of the health education department. One of those things that we do is whenever we see a spike, we make sure that we get the information out so that people, if they know someone that does illicit substances or that is doing illicit substances, they know and can be aware, and hopefully they can make smarter decisions.
This is a relatively new development, right? I mean, relatively within the last several years.
Yeah. So this was we started tracking overdoses in 2020, actually, when we put out our, I think it's the opioid needs assessment. That's also when we hired on a health educator that is specifically for substances, and so for substance use disorder specifically. And so we do a lot of around that because there was also around that time there was it was declared an epidemic for opioid use. In Reno County, we are not our opioid use is not high. It's actually more methamphetamines that we worry about here. We have naloxone everywhere because that is an important part of this whole process. So making sure that people, if they are overdosing, have access to life-saving medication. And so there's naloxone available. There's actually a free vending machine right out on 2nd Street and
almost by Monroe.
Right outside of Stock Recovery. And so great place. You just go put in your zip code and it spits out 2 free boxes of naloxone so you can carry it with you just in case someone's having an overdose around you. Because you just never know. I mean, it could be grandma who took too many pain pills, right? Like overdoses happen to anybody and they can happen anywhere. And so having that in your back pocket is always great. It's just like knowing how to do CPR or first aid,
or wearing your seatbelt.
Yeah. Well, I'd say, and at first you recognize there's a problem. You start studying and tracking the problem, and then you start responding with policy to address that problem, right? And then rinse and repeat, right? You do it over and over again and get better at it, right?
Yep.
Yeah. And so you guys have done that on a number of areas throughout your history.
Oh, yeah. Yeah. And knowing the data is an important part of what we do as well at the health department. So making sure that we have the correct data. Going back to that question about, do you know which websites or if the education is the correct education, right? So we're always doing data research. We're always looking into what's coming, what's next, how can we help eliminate whatever threat is next.
Hantavirus. What kind of guidance is coming down on hantavirus right now?
I can tell you there are some cases that are being monitored in the state. However, none of those are in Reno County. Okay. So we are doing okay on that front. But it is something, again, we have an epidemiologist on staff. We get alerts all the time about what's happening, where those cases are being tracked. And that's why we talk about tracking, right? Not just to, hunt someone down, but just so we can monitor and warn community that this may be in your community. Here's what you should watch out for. And so we are currently sitting okay in Reno County with those hantavirus
That's
cases.
good. I hope it stays that way.
Yes.
Well, I'm really glad that we were able to put this together. I'm glad that you came on and talked today. And just so listeners know, this is going to be a monthly episode. We're going to do an episode a month and put this out. And next time we're going to talk more specifically about Reno County Health Department, some of the things that you're doing there, have done in the past, and what you're working on for the future. So I'm really excited about that. I'm really thankful that you guys came in and talked with me about this today.
Yeah, thank you. It was fun.
Yeah, thanks for having us, and we're excited.
Yep, so am I. Thank you.
An Ounce of Prevention is made possible by a grant from Blue Cross Blue Shield of Kansas, Pathways to a Healthy Kansas.
Our theme music is Never Going Home by Charlie Lewis, provided by the Free Music Archive under a Creative Commons Attribution Non-Commercial Share-alike license. A Salt City Sound production.